Hi, welcome to the BariNation podcast, where we support the bariatric community with humor, humility, and honesty. I'm April.
I'm Jason.
I'm Natalie.
And if you're watching, we have the pleasure of welcoming two amazing humans to the podcast that we've never had the opportunity to interview before, Dr. Beidas and Stephanie. Hi, friends.
Hey.
We are so excited to talk to you today about the topic, which is really plastic surgery, body contouring, procedures that we can undergo after weight loss surgery. This is a very common topic in the bariatric community. And Stephanie, you're joining us today to really talk about your patient experience. Dr. Beidas, you're joining to really share your expertise in body contouring after extreme weight loss. We are thrilled to have this opportunity to really dive deep, and we have some excellent questions that have come in from our community that we are thrilled to be diving into. So before we get started, I'd love to just kind of pass the microphone to you, Dr. Beidas, and then to Stephanie to introduce yourself to any of our friends and followers that have never met you before. Dr. Beidas?
Yeah, thanks so much for having me. This is very exciting. My name is Omar Beidas, as you said. I'm a plastic surgeon, board certified, and what makes my skill set unique is I completed a one-year fellowship at the University of Pittsburgh in plastic surgery after weight loss. So I trained with a lot of the pioneers of post-weight loss surgery, people who invented techniques specific to weight loss patients. I got to spend a whole year with them doing pretty much 90% of surgeries on weight loss patients, whether bariatric surgery or diet and exercise. So it was very rewarding. And then I brought that expertise here to Orlando, where I've been practicing for over 5 years. And I'm very excited to be a part of this great community. Thanks for having me.
We are thrilled. We didn't really understand the importance of seeking out plastic surgeons that had expertise in excessive weight loss, especially after bariatric surgery. And just in all the conversations that we've had leading up to this podcast episode, it is mind-blowing. And we are so excited to be passing along this very important information to our bariatric community. So thank you for joining us. Stephanie, would you like to introduce yourself?
Yeah, my name is Steph. I had weight loss surgery in 2019. I lost 116 pounds, and after I lost that weight, I had excess skin. So I actually had 2 rounds of plastic surgery comprising of 4 different procedures. I had my first round, I had a tummy tuck and I had an arm lift, which is also called a brachioplasty. And then on my second round, I had a thigh lift and a breast lift. So I'm here today. I'm so excited to be on the podcast to just talk about my experience having plastic surgery.
Jason, Natalie, and I really talked about this episode privately, but before we recorded, and it is such a personal decision to undergo plastic surgery. And I think some of us go into bariatric surgery knowing that's something that we want to do, or we go into it thinking it's something we want to do, and then we're questioning that decision. So we know that today's episode is really going to be a useful tool for so many people who are wondering if plastic surgery after bariatric surgery is a part of their journey. So again, thank you both for joining us. And if you're watching this podcast episode on YouTube, which we highly recommend, you might be noticing that we have some very beautiful backgrounds now. We are thrilled to be announcing our partnership with AdventHealth today. We are beyond excited to be partnering with them to deliver amazing educational content, sponsor these podcast episodes, and really just partner to ensure that we are delivering quality and accurate information into the bariatric community. So huge shout out and a thank you to AdventHealth for their sponsorship and their support. And stick around for the entire episode, because at the end, we're going to talk about a very special opportunity that AdventHealth Central Florida patients will have in the BariNation membership community. Spoiler alert, it's rad. It's amazing. So without any further ado, I say, let's just dive in.
Go.
Let's do it.
All right, my friends. So if you've been listening or watching for a while, you know that we like to start off most of our podcast episodes by making sure that we are on the same page, that we are speaking the same language, and we are not going to break from that tradition in this episode. episode. So, Dr. Beidas, the first question we would like to ask you is, what is the difference between plastic surgery, cosmetic surgery, and body contouring?
So that's a great question. Typically, when we talk about plastic surgery versus cosmetic surgery, on the surface, it sounds like it can be the same. But when you dig a little bit deeper, cosmetic surgeons and people who say they're board certified in cosmetic surgery, that means something very different than someone who's board certified in plastic surgery. The training requirements for someone who's board certified in plastic surgery entail either a 5-year residency in general surgery, ENT, or some other surgical specialty, plus 3 years, 2 to 3 years of additional training in plastic surgery, or a straight after medical school doing 6 years of plastic surgery. And then that's all monitored and governed by the ACGME, which is kind of the accrediting council for medical residencies. When you talk about cosmetic surgeons, that can mean a whole lot of different things, or it can mean surgeon or doctors coming from a whole range of different specialties. It can be an internal medicine doctor who's never done a surgery in his life. Then he does a cosmetic surgery fellowship, and that's not really regulated. So it can be a weekend, it can be a month, it can be a year. And then they get this cosmetic board certification. Yeah, it's scary. I see some faces. It can be a vascular surgeon, right? Someone who's never touched an implant in their life, again, going and doing this cosmetic surgery training, and then now they can market themselves as a board certified cosmetic surgeon. And so those are two very different things. When you're a board certified plastic surgeon, you have to pass a written test first after you complete your training, and then an oral exam. And that oral exam includes a lot of ethical and safety questions because our board holds us to a very high standard. Again, I don't know that the American Board of Cosmetic Surgery has the same standards of safety and ethics that we do. So that's the big difference between those two branches. Now, when you talk about body contouring is the best way to think of it is a branch or subset of plastic surgery. It doesn't necessarily mean only after weight loss. So it can be just someone wanting, coming in and having an arm lift or a tummy tuck or a breast augmentation. But I would say colloquially, yes, it kind of refers more to patients after weight loss, but is kind of just sculpting, contouring the body.
Okay. So just to make sure I'm understanding this, right? So cosmetic surgery would be like, I have a degree in education. Body contouring would be, I have a degree in education, but I specialize in early childhood education. That's kind of the flow of that.
I think you said cosmetic plastic surgery, then body contouring.
Oh, yeah. Okay. Yeah. Excuse me. Yep. Yes. Yep. Okay. So why would people then, I guess, if you know it sounds like a pretty large difference between a plastic surgeon and a cosmetic surgeon, why would somebody opt to maybe have these procedures done with a cosmetic surgeon and not a plastic surgeon?
Great question. And we often ask ourselves that same question. I think a lot of it, unfortunately, comes down to education. A lot of people out there don't know that there's a difference. Patients don't realize that someone who's a board certified cosmetic surgeon is not the same thing. And so our society, the American Society of Plastic Surgeons, has devoted a lot of our time and effort into trying to get that education out. Unfortunately, it's these people are operating or working within the realm of the law, so it's not illegal for them to do this. But again, they don't have that same ethical and safety standard that we have. And so the rate of complications and the safety factor is definitely an issue that we are concerned about as plastic surgeons. And we want to educate the public about the differences between a cosmetic surgeon and a plastic surgeon. Yes,
which is why this conversation is so important.
Exactly.
That's a big difference. That's huge. That's huge. And I guess I would assume, like Jason and Natalie, please chime in here too. I wouldn't even know that there was a difference had I not been a part of this conversation. That's just not something that was ever brought up when I was originally going in for my bariatric surgery. And even thinking about it, I mean, even as I just did, I confuse plastic surgery and cosmetic surgery. I think they're one and the same, but they're not. They're very different.
Because a lot of folks that I've talked to, and not bariatric related, just in my life, we use those terms very interchangeably. And I think that's where that misinformation or the lack of education comes in. I used to use them interchangeably, those two terms, but they mean so vastly different things. So I'm excited to learn. I'm already learning more, but I'm excited to go even further.
Yeah, no, absolutely. I learned not too long ago kind of the similar, like the what we thought was similar was so vastly different. And it was very eye-opening to me because I know a lot of people that were in consultations with surgeons who just had their, the kind of, I'm not a plastic surgeon, but I stayed at a Holiday Inn last night, that kind of gig. And I'm like, yeah. And then once they found out that same information, they were like, oh, well, then let me not do that. Let me get, to somebody who's better qualified. And that's, not saying that those people would necessarily do a bad job, but I myself want somebody that's got a little more time doing what they're doing before they come over and start hacking on me. I'm just saying.
Mm-hmm. Well, and I appreciate you saying that, Jason. It's not that cosmetic surgeons aren't skilled and trained at what they do, but the level of training, the level of expertise, the level of education that's required is very different. So as a patient, you do want to make sure that you understand the difference between a plastic surgeon and a cosmetic surgeon, and that if you are thinking about a procedure, that maybe you interview both, or you start with a plastic surgeon and then seek out someone else. Dr. Beidas, in your introduction with us, you said that you spent a lot of your training specifically with weight loss surgery patients, or patients that had lost a significant amount of weight. Why is it important that we are seeking out somebody with your credentials, or with your training, or with your expertise? Why is it important?
So that's, again, another good question. I think in plastic surgery, anytime you're seeking some kind of procedure, you want to go to someone who has a lot of experience doing that procedure. Whether it's a breast augmentation, a tummy tuck, you don't want to go to in my opinion, you don't want to go to the guy who does, one every few months. You want to go to the guy who's doing one a week or one every other week. The guy or gal, I guess. And so, by that same token, spending a year doing this, and again, I worked at the University of Pittsburgh. Dr. Peter Rubin and Dr. Jeffrey Gosselinoff were two of my mentors, and these guys, they write the textbooks, right? So when other surgeons who maybe didn't do the same training are looking for guidance or looking up how to do a procedure, they're reading the chapters by these guys. But it's different when you read something versus when you've done it, seen them do it, helping them do it, and then you're doing it yourself. And so I think that's highly valuable. I think one of the main things that maybe even patients don't realize is that weight loss patients, the skin after the weight loss, right, is very different from a non-weight loss patient. And the tissue characteristics when we're dealing with that, if you don't have a lot of experience with it, it can be daunting, and it can be difficult to determine exactly how much skin to remove, how much skin relaxation is going to happen. And even as much experience as I have, I tell patients there's some times where we're going to have to go back and do a revision because the skin quality or the skin characteristics are a little bit unpredictable. So I think having that knowledge, but also knowing to have that conversation with patients is paramount to having a good physician-patient relationship.
AdventHealth is home to the #1 bariatric surgery program in Central Florida. With 4 convenient locations and a team of nationally recognized surgeons, their comprehensive team provides support for patients that goes far beyond surgery. Whether you're pre-op, considering a revision, or plastic surgery, you can learn more at AdventHealthWeightLoss.com.
Yeah, I mean, it certainly sounds like a question we as patients should be asking whoever we're interviewing for any type of procedure is, do you have any experience with people that have gone through significant weight loss? And then ask them to really describe those procedures that they have a lot of expertise in doing. And I think also too, as a patient, I mean, I know, Stephanie, you're a bariatric patient as well. I went into surgery really just thinking I was only going to need one procedure. And we know that's not the case. So many members of our community have gone through revisional surgery. Jason's just recovering from one. So to know that this might be something that you need to revisit again with your surgeon, I think it's just also setting yourself up for success. You're asking the right questions. You know that more procedures or some corrections might be needed, and that could just be a part of your journey, just like revisional surgery could be a part of your bariatric journey. So, Dr. Beidas, what procedures are most common with bariatric patients?
So I would say, at least in my practice, the most common procedure that patients are having done is, so we talk about these skin removal surgeries. And so the abdomen is the most common site I'll operate on. In both men and women, I would say the chest is probably second most common. And then after that would be arms. As Stephanie said, that's a brachioplasty or an arm lift. And then there's a lot of other options. It's tough to kind of quantify these in terms of what's the most popular, but there's the back, and then that can be divided in the upper back and the lower back, or the buttock area, and then the thighs. So those are the most common, and then certainly there's the face or the neck area, and that's probably low on most patients' priority lists. Certainly financial considerations have to be taken into account when we talk about these things. But for sure, I would say the trunk, so frontal trunk, chest, and abdomen are the two most common spots we operate on.
Okay, fantastic. Well, and we had some excellent questions that came in from our BariNation membership community, kind of about those really specific procedures. And they really wanted to know, like, how do I best prepare? What is the recovery time like? What kind of results can I expect from these specific procedures? So if you are a member of the BariNation support community, or you are a supporter on Patreon, you're going to get access to that episode after this one drops. And now would be a really great time to join or support either one of those. But I think for this conversation, a great place to kind of move to now is on to Stephanie. And we're excited because you're going to share with us your own patient experience when it comes to your plastic surgery.
Yeah. So I'll just start with the fact that I actually had lost weight and maintained for 6 to 7 months before I actually went ahead and had surgery. And I know Dr. Beidas probably will also speak to that you want to be maintaining your weight. You don't necessarily want to be like almost there. You pretty much want to be where you are and maintaining your weight. So I had been maintaining for 7 months when I had my first round. And then after I had those 2 procedures, I waited another 7 months so I could recover and just really start feeling back to myself, get back in the gym, and prepare myself for the next round of plastic surgery. So that's pretty much how the process went and the time frame for my surgery.
Well, I know that in speaking with Dr. Beidas and hearing him speak at separate locations and different times, was that one of the things that he drove home a lot is there's going to be certain things that you can kind of piggyback on top of each other at the same time, but there's things that they won't piggyback because you don't want to be down. You don't want all, they're not going to do like an arm, breast, and thighs at the same time because you don't want all your limbs, to be to be out of use while you're recovering. So I know that you just speaking to that and the fact that you spent some time in between and hit the gym for that. How did that aid in your recovery, the gym time and kind of getting prepared? How did that help you?
It helped me so much because I was so concerned about the thigh lift because I heard stories of how hard the thigh lift was, and I was really nervous about it. But I'm like, okay, I'm going to prepare myself as best as I can. I'm going to eat lots, of course, I always eat all my protein, but I'm going to make sure that my nutrition is in check. I want to work out a lot. I want my legs to be in best shape as possible when I go in for that surgery. And it helped me. I recovered from my thigh lift faster than any other one of my procedures. 5 weeks, and I was feeling much better. I was back in the gym, not like leg pressing or anything at 5 weeks, but, doing a slow walk on the treadmill. I was cleared for doing that, and then slowly progressed back to my, weightlifting. But I definitely attribute being prepared and physically prepared for that surgery to having a quick recovery.
So what was your process thinking back now after you had lost the weight and been maintaining? Like at what point did you decide that those changes, do you felt like those changes needed to be made?
I really, going to the gym is very important to me. And when I saw that the skin was holding me back from jumping, from running, I don't do a lot of running, but any kind of like movement where I'm bouncing the skin, I mean, it would hurt, it would pull, and sometimes it would tear because it was so thin. And I'm like, I can't do the workout that I want to do with this skin, and just I knew that going, after losing all that weight, that was probably the one thing, if I was going to do anything, was just going to be having the tummy skin removed. And I'm super happy I did it.
So is it kind of the same process for the arms and the thighs as well? Kind of the same thought process as far as holding you back goes, or once you got the tummy done, did the other things kind of enter your mind as well?
So I had my arms done at the same time as my tummy because
Oh,
those were the two areas that bothered me the most when I was working out. But for sure, I would say the tummy was more of the movement, and the arms, yes, they also, I had some skin movement that didn't hurt as much as the tummy did, but for sure, it is that procedure was one that I wanted to get done right away. But the tummy was the one that was like 100%. I'm having this. It just so happened that I could have the arms done at the same time, which I was like, okay, I'm going for it.
that's awesome. I mean, that makes perfect sense. So, what do you wish more patients knew about plastic surgery before making the decision to have it?
I think they need to set like realistic expectations of what the results are going to be like, because especially for weight loss, massive weight loss, you're not going to be perfect. When you take care of one area, then you're going to see another area. And it's like, you have to kind of I see April's like, I got something with that. But like, when do you stop? Because like I could go on, but I took care of the things that I needed to for right now. I'm not saying I'm never going to do another procedure again. I mean, it could be something in the future, but um, just knowing that, having the expectations that it might not be perfect. I'd still have some loose skin. After time, the skin kind of laxes a little bit, and I'm not going to go back and get another tummy tuck. That's, for me, that would be purely cosmetic, and I don't need that. So I think just setting those realistic expectations would be my number one, and number two is one of your favorite sayings, giving yourself grace, because you really need the time mentally and physically to recover. You might be feeling better at 3 weeks, but you need as much time as you need to give yourself. You need to follow your surgeon's instructions as to when you're clear to do different things. And, just don't push yourself. You have so much time to get back to the gym and get back to your normal life. Just know that you need to set that time and self-care for yourself.
Yeah. Well, I mean, and it does make perfect sense though when you're talking about how, you see one, you fix one, you see something else, you go, and like people will continue to chase that, chase those imperfections until and you nailed it perfectly. You were like, there's nothing that's going to make us perfect. You see those people that continue to chase plastic surgery, things and like that, and like how sometimes it goes, it doesn't go the best for them. And you feel awful because you know what they were trying to do, what they wanted, and you just feel awful because it's like, oh, well, it wasn't always the best outcome for that. But the fact that you went into it with the mindset of knowing that that could possibly be the case, I think that's probably the strongest message to give to somebody who is thinking about plastic surgery, because there is going to be times where you think, oh, just like with, like April said, just like with bariatric surgery, you think we're just going to have the surgery be done, we're going to be thin and everything's going to be fantastic. You wake up from surgery, be like, hey, am I skinny yet? Like, no, we got some time. But but as time goes on, like, you have to realize, like, there are going to be those times where you could do more, but you have to rein it in and say, I can work with what I have because it's farther than where I came from. So let's just make the best of what we got and start working that aspect before you try to do anything different.
Exactly.
I am literally like busting at the seams here, because when you said that, Steph, I just went back to when I was trying to come to peace with the weight my body wants me to be at, not the weight that I thought I could get to. Right? Like I went in thinking I was going to be 150 pounds, or I was going to work really hard to 150 pounds. And then all of a sudden I was nitpicking every little thing about my bariatric journey. I was obsessing over every macro, every vitamin, every ounce of water, because there was always something I could do better and improve, but it was never going to get me to this place of perfection that I had built up in my mind. And I hear my struggle, right, with my bariatric journey echoed in your realization of what you've come to understand is where you're at peace or acceptance or happy or just, you know, living in your body. You've done so much work, your bariatric journey, and then your plastic surgery journey as well, to get to this body that you accept and love. And I don't want to put words in your mouth, but it's very inspiring to hear how you got there, and that you're okay today with saying, no, this is good. This is where I'm at. This is just what happens with skin. It's not a bariatric issue. This is the human body as it changes throughout life. And that was just, wow, that was really powerful. Thank you.
All right,
So-
Nat, you want to finish us off?
Sure. So I know that a lot of us, bariatric patients, non-bariatric patients, especially in the BariNation community though, and I know April, Jason, and I have really talked about plastics in general. A lot of us just don't even know how to begin the process. So I just wanted to give time for you, Dr. Beidas and Stephanie, to walk us through it. And the first one is just, is this even covered by insurance? Is plastic surgery, body contouring, is it covered by insurance? Dr. Beidas, I'll let you go.
So yeah, common question we get, very good one. And so most insurance plans, if they have coverage for skin removal after weight loss, whether it be after bariatric surgery or diet and exercise, will approve or cover the removal of the skin from the abdomen if patients meet certain criteria. And those are spelled out in your plan. Excuse me. Unfortunately, there are a lot of plans with exclusions for this, probably similar to bariatric surgery. If people have gone through that journey and they were trying to get approval for bariatric surgery, there are exclusions for that as well. And the analogy I make for that is, you know, it's kind of like flood insurance on your house policy. Sometimes it's an exclusion, so no matter what, they're not paying for it. In our experience, because we do a lot of this, I would say about 90% of patients after bariatric surgery who have lost over 50 pounds will meet criteria for skin removal to be covered by insurance. And that's of the subset who have the policy language that says that they'll approve it.
Okay, that makes sense. And I've heard stories, you know, similar to you, Steph, with like, oh, I had a rash, and that's how insurance was able to cover it, or those having those like exclusions or those rules. So I guess, yeah, just asking your insurance provider for those guidelines. Without insurance, because that does happen, as you said, how do patients pay for their procedures? How does that work?
So at least at AdventHealth, at our office here, we like credit cards, but we also accept care credit, which is, some people might be familiar with if you've had dental work or had kids that needed dental work. It's basically kind of a loan that can be applied for medical purposes. Patients sometimes also get creative and use their HSA, FSA accounts if they have those. You know, because that covers any kind of medical procedure. So plastic surgery, yeah, it's a good idea. Patients will sometimes get creative and use those accounts to pay for their procedures. So there's a whole range of options. We love Care Credit. They have fantastic terms. And that's probably the most common way people pay for their procedures. I
just had a question pop into my head. And And I guess that's a question I'm asking myself. Maybe you're listening or you're watching this episode and plastic surgery is something that you would like for one of the reasons that Stephanie described, or for something else that you're thinking, mobility, or just you want to look a certain way. Have you ever counseled people who've come into your office for a consultation and they're worried about justifying maybe an out-of-pocket cost for this? Or Stephanie, was this kind of a conversation that you had with yourself about paying for this procedure? And I guess my big question is, yeah, have you helped people kind of overcome that feeling of I don't deserve this, or feeling guilt or shame for having a plastic surgery procedure that maybe in their brains they think is more about vanity and how they look?
With 6 surgeons in 4 locations across Central Florida, AdventHealth is home to the region's largest and most comprehensive bariatric surgery program. Having helped over 12,000 patients on their weight loss journeys, you're in good hands with AdventHealth's nationally recognized experts.
So when I knew that even before I had bariatric surgery that I was going to need skin removal. So I had some time to plan and to save. And I knew it was going to be part of my journey from the get-go. I have lost weight before having bariatric surgery and had loose skin at that point as well. So I knew it was going to be part of my journey. So I didn't feel guilty about it. I knew it was just going to be part of self-care, and it's the best money that I ever invested in myself.
That's great. I think so. To answer your question, April, I would say, unfortunately, I hear that a lot in consultations. Most of our patients are women. So I have the woman who shows up to my office and says, "Yeah, my mom or my daughter or my spouse thinks I'm doing this out of vanity," and that's actually not true. I mean, even when we talk about cosmetic plastic surgery, like truly like a breast augmentation or a tummy tuck, um, I think you have to take vanity out of the equation, because I think a lot of it is how it makes people feel afterwards, right? And that's not something you can really put a price on. So I think and there's actually in body contouring or plastic surgery after weight loss, there are a lot of studies that have shown the physical improvements, right? I mean, Stephanie, you mentioned some of them, carrying that weight around, being able to wear clothing that fits. But there's also studies that have shown a huge social improvement. I mean, think of like your intimate relationships, being out at the beach. I hear a lot of patients, like men won't take their shirts off, right? Because they don't want to show their skin. And then kind of psychological improvements. And that's been borne out in studies. And actually in Europe and some outside countries, these procedures are covered by insurance. So unfortunately, we're a little bit behind the times, but there's definitely a proven benefit to plastic surgery after weight loss outside of the vanity aspect. And then the second thing I tell patients is, some people like to spend their money on boats. Some people like to spend their money on season tickets to their favorite basketball or football team. People don't judge them or criticize them. And so I tell patients, if this is what you want to spend your money on, then who's your whoever to tell you not to.
It's funny that you mentioned that, though, because we've got a Cancun trip planned with Bariatric Society in February, and my wife's like, "Why are you buying all these T-shirts? Like, you don't need it for the beach." And I was like, "Because I'm not going." She's like, "You're not going to take your shirt off at the beach?" I was like, "Absolutely not. Like, that's not even a thing." I haven't been in any body of water without a shirt on, and I maybe 20 some odd years. So
Yeah.
Don't see it happening anytime soon. It really doesn't matter what my weight's in that. It's just a comfort thing for me at this point. So yeah, but it's funny that you brought that up, because I'm like, yeah, we just had that conversation last night, and I was like,
and surgery can change that, right? I mean, that's the beauty of it. I mean, it's the confidence and the motivation. So,
And I think too, it really boils down to your intention going into it. I think that's a conversation that I've had a lot with members of the BariNation support community. I know, we've talked with Steph about this. It's the intention that you go into these surgeries, whether it's bariatric surgery, whether it's plastic surgery. It's like, why? Really being real with yourself and saying, the reason I am doing this is fill in the blank. If it is vanity, cool. Like, go for it. That's cool too. Like, that's fine. If it's a pain thing, if you have a rash, like, you shouldn't live with a rash. Like, that's okay to get plastic surgery for that. There are so many reasons, but I think at the end of the day, it really is my intention to make me feel more at peace with my body? Is my intention to make me feel better about myself and my body? That's at least what I'm hearing from the both of you. And it's what I've heard from folks. I have friends that have had plastics after weight loss surgery, and it's a lot of head work. And Stephanie mentioned that earlier. It's a lot of head work. It's a lot of mindset. And I think that is, I haven't even had plastics, but that's what I want to drive home is you really have to have those intentions.
Yeah, absolutely.
So I would love to ask, I know a lot of patients, there's a lot of information. You go to Google, you're like, I want to get plastic surgery. I want to get body contouring. Where do people even start? And I would love to start with Dr. Beidas, and then Steph, I would love to hear from you about how you started that journey, that thought process.
So, I think the best place is to do your research. I think kind of maybe even taking a step back, and Stephanie and Jason mentioned this. And Jason, I'm very happy you remembered what I said about having a stable weight. I'm glad you were paying attention and remember that years later. But first thing is having a stable weight, making sure you have a healthy diet. Stephanie also touched on having realistic expectations, and that's partially on the surgeon as well, to make sure we're level setting expectations. If a patient's coming in and expecting to look a certain way and I can't meet that, then I have to bring them down like, hey, we're going to be more here. And if that's not acceptable to them, then I don't want to operate on that patient because I don't want an unhappy patient. So to that end, doing your research, seeing before and afters, again, going back to board certification, making sure you're seeing a board certified plastic surgeon by the American Board of Plastic Surgery, and you can look that up at abplasticsurgery.org. And then some of the other things we talked about earlier, making sure they do that procedure a fair amount with a high volume. Again, not doing like one arm lift a year, but maybe at least an arm lift a month or one every week. And like I was saying earlier, the difference between the way I like to make the analogy between a plastic surgeon and a cosmetic surgeon, when I explain it to patients is I tell them you don't go to an electrician to do your plumbing work or vice versa. And that's kind of what you get when you're going to a cosmetic surgeon to do some of these procedures.
Gotcha.
And I'm going to, oh, I'm sorry, go ahead.
I was just asking how you got started. How did you start your process?
Everything that Dr. Beidas just said. I made sure to make several consultations because I wanted to get, opinions. I wanted to look and see before and afters. I wanted to find out, how many arm lifts have you done? Where's your scar placement? I had certain expectations of where I wanted that to fall. I knew I was going to have a scar, but there's several, different places that they can put it. And I had in my head where I wanted it. So, that was part of my selection, as far as also where my tummy tuck scar was going to be too, because some surgeons will put them up higher, lower. So that was important for me. But again, meeting the surgeons, preferably face to face, because you can really get a sense for their personality, their bedside manner, working with the office staff, how responsive the office staff is to you, because I think the last thing, after surgery, if you have a question, are they going to call me back? Are they attentive to me before I even have my consultation? If check that box, yes, okay, so now I feel comfortable. So I think those are all things to think about in your process for getting started.
Who you choose for plastic surgery is just as important as choosing your bariatric surgery program. AdventHealth not only offers the area's most comprehensive weight loss surgery team, but their plastic surgery team has a specialized focus in body contouring in patients who have experienced extreme weight loss. Choosing an experienced provider is important for achieving the result you're looking for.
Did you go belly button shopping?
I did.
That's my favorite story of anybody that has plastic. So like, let me see your belly buttons.
Yeah, it's a dead giveaway, right? We spend a lot of time working on our belly buttons in the OR to make sure patients don't look like they had plastic surgery.
Yeah, that was the funniest thing to me I ever heard. They were like, look, I was like, I had to drop my surgeon. I was like, why? He's like, because I don't like his belly buttons. I was like, I'm sorry, what?
I think one thing, sorry to go back a little, just to add, and not to sound like a broken record, but another main difference, Natalie, when you were asking about where to start and who to look for, as plastic surgeons, one of the things I talked about earlier was safety. And so we are bound by our society to have privileges at a hospital. So a lot of private plastic surgeons out there are great. There's no problem with them, but they will have privileges at a hospital. So if something were to go wrong, say a patient were to have bleeding or, clotting in the leg or clotting in the lungs that might require a hospital admission, that surgeon has admitting privileges, can see you there, can round on you, can take you to the operating room if you need to. That doesn't hold true for cosmetic surgeons. So kind of another big difference there between the two types of surgeons out there that you might see.
I would have never in a million years even thought about that. But I mean, in many ways, just like with your bariatric surgery, you want to be prepared for all outcomes. And if you do need additional medical support after your procedure, you probably want to make sure that you can be seen in a hospital by your surgeon and other skilled professionals.
Right. Yeah.
Wouldn't have even put two and two together. So very thankful that you said that. Well, I'm just, and I say this, I feel like almost every episode, and I know I'm speaking for Jason and Natalie too. We've been having these conversations now for 4 years, and every time we have an opportunity to speak with experts and patient experts like both of you, we leave the conversation with so much more information. We are just so better prepared for our life as a bariatric patient, whether that involves plastic surgery, cosmetic surgery, body contouring, or not. This information really helps us advocate for our own patient needs as we move through our bariatric journey. I mean, just unbelievable. We always love to kind of give the microphone to our guests at the end of this podcast episode. So is there one thing that you want to leave our listeners, our watchers, and our friends and followers with today around this conversation when it comes to plastic surgery? And Dr. Beidas, we'll start with you.
I would say, well, thanks, first of all, for having me. This has been great, and I always love educating patients. I would say, if you have any questions, feel free to reach out to me on Instagram. My handle is @DrBodyContouring. That's DR Body Contouring. And then if you're looking to have an appointment or a consultation, we do virtual appointments. So even if you're not in the city of Orlando or near AdventHealth, we can certainly see you. The link to request an appointment is PRS for plastic and reconstructive surgery. So prsappointment.com. And we're looking forward to seeing you.
Steph, what about you?
Yeah, I'll just end with I am in the Instagram and TikTok community as Metamorphosis Steph, and I'm always there to answer questions from someone who's been through it. I try to answer all of my direct messages, so I'm there to support. And I'm so thankful that you guys invited me to come on the show tonight to share my story. Love you guys, and I appreciate it.
Oh, Stephanie, we have been friends for a very long time now, and your story is inspiring, it's uplifting, it's real, it's honest, it's truthful, it's approachable, it's all of those wonderful things. And if you are watching this and you are just feeling this connection with Stephanie now and you're a patient, wait until you meet her in person. She's the most lovely human in the world. And Dr. Beidas, I haven't had the opportunity to meet you yet in person. I hope we all get to soon. And we're just so thankful for your time, your expertise, and your willingness to really educate patients in very meaningful ways. And know too, friends, even if you don't live in Florida, if you're not in the Central Florida region, you can reach out to Dr. Beidas. You can reach out to Stephanie for that information. There is wonderful resources that are available to you. And if listening to this podcast or watching this podcast is your beginning step Wonderful. You are doing the work of weight loss surgery. You are doing the work of advocating for yourself. And we are excited to continue to connect you with resources that matter. And if you have listened or watched this podcast and all of a sudden these questions are popping into your head, send us a DM with those questions and we will connect with Dr. Beidas and with Stephanie, and maybe we'll be able to invite them back on a future podcast episode. So we would love to continue this conversation with you, either through Instagram or in the BariNation membership community, which is a wonderful segue into the thing that we are very excited to share with the world. Part of our partnership with AdventHealth includes extending discounted monthly membership rates to patients of AdventHealth. So if you're watching this screen, you see there's a little QR code right here in the corner. If you scan that QR code, it is going to take you to that discounted monthly rate opportunity. And for $29 a month, AdventHealth is ensuring that patients can access that additional support, the resources, and the community that they need to find and maintain personal wellness. So a huge thank you to AdventHealth for this amazing partnership and this podcast opportunity. So just thank you. Thank you. Thank you. Jason, my friend, you want to take us out?
Yes, ma'am. Just please, yeah, like April said, please take advantage of this amazing discount for this partnership. Use the QR code. It's going to help tremendously. As far as the podcast goes, if you could share this with somebody that you think would benefit from it, please do so, because the more people we can help reach that need the assistance and the support, the better off we'll be as a community, because people helping people, that's what it's all about. And then also, if you found value in today's episode, you can support it by becoming a member of our Patreon channel. So thank you guys so much for that. It's only $5 a month. You guys can support the podcast, help us keep the Zoom lights on. And just remember, at the end of the day, you've got this, we've got you, and we will see you next time.
Awesome. Thank you, friends.
Bye.
Thanks for having us.